Susan?
That's me.
Great. So what's the problem?
So, I recently noticed that my right upper lip doesn't look normal.
Oh dear, your poor smile.
Easy now, you mustn't hurt a poor guy's feelings. I noticed I have some swelling too, in my poor fat cheek.
Ooh, yeah, let's have a look-see.
Dr. Burke examines Suzanne's face by inspection and palpation and notices a 2 centimeter noodle just anterior to Suzanne's right ear lobe that concerns her.
I feel a lump in the area of swelling that concerns me.
Concerns you? It should concern me more!
I'm going to run you through a series of tests to assess your cranial nerve functions.
Dr. Berg continues with a cranial nerve examination to test the function of the 12 cranial nerves and assess any damage to the facial nerve, which could be causing Susan's smile to be poor.
Could you raise your eyebrows for me? Frown. Close your eyes. Show your upper and lower teeth at the same time. Smile. Puff out your cheeks. Susan, it appears to me that your poor smile might be a result as a malfunction in your facial nerve.
What the heck does that mean?
Well, you see there are 12 cranial nerves that stem from your brain and relay information between the brain and the body, primarily your head and your neck. The facial nerve is the 7th cranial nerve. It comes from the brain and connects to the small muscles in your face. Their function is to help the facial muscles move during different facial expressions like smiling, frowning, closing your eyes, moving your lips, moving your cheeks, lifting your eyebrows, and conveying taste. If the 7th cranial nerve fails to function properly, like it seems yours is, the facial muscles may suddenly weaken or get paralyzed temporarily, leading to a medical condition known as Bell's palsy.
Well, Bell's palsy is a paralysis or weakness of the muscles on one side of your face. Damage to the facial nerve that controls muscles on one side of the face causes the side of your face to droop. The nerve damage may also affect your sense of taste and how you make tears and saliva. The cause of Bell's palsy is not clear. Most cases are thought to be caused by the herpes virus that causes cold sores. But Bell's palsy is not the result of a stroke like some people think. This condition comes only suddenly, often overnight, and usually gets better on its own within a few weeks, but can potentially have long-lasting effects. In most cases of Bell's palsy, the nerve that controls the muscle on one side of the face is damaged by inflammation. Sudden weakness that occurs on one side of your face should be checked by a doctor right away to rule out these more serious cases.
Well, Susan, I think I'm going to refer you to a good friend of mine, Chaz Robinson. He's a oral maxillofacial surgeon, and we're going to make sure that nodule gets taken care of, and he can run some other tests to check out your facial nerve.
Action. Dr. Robbins does a fine needle aspiration biopsy of the suspicious nodule and a CT of Susan's head and neck.
Susan, the fine needle aspiration biopsy obtained a preauricular mass, which is suggestive of a salivary gland malignancy known as an adenoid cystic carcinoma. Long story short, we unfortunately found a 2-centimeter swelling inside your parotid gland that has to be surgically removed.
Oh my gosh, am I gonna die?
No, you're not gonna die. We have to remove your parotid gland and part of your facial nerve.
Oh my gosh.
This is gonna result in you having less saliva production.
Oh my gosh.
And we'll have you set up with some radiation therapy for further protection of the spreading of the cancer.
Oh, thank God. Whatever you gotta do, as long as I'm alive.
Susan, how are you feeling today?
I'm feeling a lot better, but unfortunately, I lost my sense of taste.
Well, Susan, that's probably a result of the damage of the chorda tympani, which is a branch of the facial nerve that we operated on 10 years ago. It's the branch that is responsible for the special sensory of taste and the anterior 2/3 of your tongue.
What? Basically, you're telling me that I can't eat anything anymore? I love food!
I'm so sorry, but basically, yeah, there's nothing you can do. The end.
Get boogie down, down, the pole, the boogie down.